So if there are any board members online, I can't read it from here.
It's supposed to be Mark, but I haven't seen him.
Yeah,
No board members.
no.
Do we have a forum there?
Yeah.
Three and three.
Yeah,
Okay.
yeah, yes, we do.
Yeah.
The record will show that we have a quorum.
And I'm
I
gonna go
used to be
ahead
the parliamentarian for the Republican State Convention. It didn't matter what the facts were. The chair would say, Mr. Parliamentarian, do we have a quorum? So, well, of course.
I'm gonna go ahead and read this first.
Okay.
All right, so please be advised that this is a public meeting in accordance with open door law that is being live streamed to the public and recorded. The recording will be archived and available to the public for no less than 90 days. By attending and participating in this meeting, you acknowledge and consent to the live streaming and recording of the meeting, including your image, voice, and any contributions you make. For HHS Board of Director members, because you are invited as a presenter, you can unmute yourself and turn your camera on. For other virtual attendees, if you have a question or want to make a comment, you will need to either raise your hand or let us know via the Q&A, not the chat, and we will open your line. You can then unmute yourself to participate. The recording will be published and cannot be edited.
We all have the minutes of our last meeting before us. Any modifications, scrivener's errors, corrections, enlargements? Then I'll take it by unanimous consent that the minutes are. Finance report, who's giving that report?
Yep, I can go ahead and do that, yep. All right, so first, the Builders Initiative grant. We have received the second installment of that. And now we're just working on getting that transferred over to the Division of Nutrition and Physical Activity to continue executing the work plan for food as medicine work that particular grant is looking for. Any questions in regards to that? All right, the Lake City Bank, I have some documents for you all to sign, just updating with my name and information on there with the Lake City account. So I can go ahead and do that after this and get everybody's signatures where needed. There's like 4 different documents. And then the 990, John and I worked on that portal with CLA, who is our accounting group, and we got that submitted this week, and also got the annual comprehensive financial report submitted this week as well.
Did you email it to us or?
Nope, but I can.
Okay.
That
Should, yeah.
is something to
Yeah.
pull.
This is just the draft that we send over to them. They will then take that and then create the one then for.
Oh,
practice.
okay, all
This
right.
is-
So I
This
was,
is just like the,
the preliminary, I thought it was the final, sorry.
yeah, it kind of looks a little bit like TurboTax. If you ever, like, you just kind of enter into each little blank, some facts and information and upload that.
So it's in process right now.
Yeah. But as far as the 990s go, with the new executive order, I've got the 5 last 990s, 2019 through 2023 from CLA. Because we got to get those posted on the website by the end of the year.
Can you explain all the new changes for the executive order? I'm a little confused. Like, what do we do differently? I know that it's open, but beyond that, is there anything else?
Yeah, do you want to
Yeah.
comment on that one?
I just want to understand.
Yeah, let me, if I can pull it up really quick, and I can actually, if it's helpful, print it off for everybody too.
And there should be a copy of
It's
it.
right here.
in-
Oh, we
Yep,
got it.
I got a copy.
Yeah, I have the executive order. I just asked how it pertains to us. Yeah.
So what it's basically doing is capturing all of the state affiliated nonprofits and setting up better expectations for them. Ourselves and kind of look, and I'll say like State Museum Foundation, the War Memorials Foundation, everybody operated a little bit differently. Some of them were closer to quasi-agencies. Other ones were closer to like the Healthy Hoosier Foundation, which operated kind of more independently, but still like affiliated with an agency. So what this is really doing is just setting up a list of expectations that all the 990s are going to be on the website for the for each of the nonprofits just for better transparency, as well as to kind of see like what is going into these organizations and the activities that they're doing. There's been, and it has not been us, and I'll say that, there has been some concern about like lack of transparency for some of the foundations, people not necessarily understanding like where that money is coming from. So this is just we all are all kind of looped in.
Okay,
So, and so Michelle will work on gathering all of those 990s and then issuing them on our website.
so it's just the 990s that have to be published, not every paper that we get and see.
Every paper is subject to the public records law,
Mhm.
where they can be requested, but they're not required to be published.
Okay, that was,
And our 990 is already published through third parties.
right,
So ProPublica publishes all 990s.
right.
So we just, the governor's asking that we post ours separately and all these others here. And if you read the order carefully, it's clearly directed at one or two agencies, not us.
Yeah, we just happen to be listed first.
Okay.
Why do you suppose that is? I mean, I thought it's an alphabet.
We're not the ones that really, but we are at the top of the list.
Yeah, we are.
I think it's because maybe I was working with the governor's general counsel, like when we were developing some of these things, so he knew that that was something we had,
The
so,
top of the line.
yes.
All the others start with Indiana. We start with healthy.
Yeah,
So
maybe
we
it's
can
so
help.
far high.
Michelle, you said you obtained the last of the 990s? By 19 through 23. And then Andrew, who's the contact there at CLA, said that we can go on probably the IRS website and get the other ones.
Okay,
Have them on file.
okay, good, thank you, that helps. I wasn't sure that every single piece of paper, I don't understand legal lingo.
I'll make it worse for you. So we are 501c3, 1. 2, we are an Indiana not-for-profit corporation. The advantage of a 501c3 is we pay no taxes and contributions to us are tax deductible,
Right.
which is different than a C4, C5,
Right.
C6. However, footnote, we are a type 1, which means we derive our status by supporting an organization which is exempt.
Okay,
And the organization we support is the state of Indiana. And the rules for type 1 are that the supported organization must appoint a majority of the boards of the sporting organization, which is all mumbo jumbo, but that's what it is. And in our case, the governor appoints 100% of our board. So the governor has constructive knowledge of everything that happens here. So what this executive order does is just say, we'll do the paperwork. State Board of Accounts already comes in, does an audit, I get interviewed
okay,
by them. Not like we're processing tens of millions of dollars, so it's not very complicated. I think it's a compliance issue and a transparency, although I'll bet you $100 if we Google ourselves right now, we would find the 2023 tax returns.
Hi, Laura.
Hey, Laura,
Hi, Laura.
you haven't been on the circle with the marching bands, have you?
No.
Did you have problem parking?
No, I parked in a garage a couple blocks away. I don't come downtown Indy, so if I see parking, I just take it.
Yeah.
I can walk. I can walk miles every day. I can walk, to the.
Well, we just finalized the financial report. Okay, topic. And any other additional questions there? All right. Excellent. John, on the health department updates, did you want to provide any or wait for Dr. Weaver to come later?
I mean, I think I can probably
Okay.
provide some of the substantive updates. So obviously, probably one that will impact the board is, I will be the chief of staff for the department. But I'm leaving you in very good hands, no concerns there. But also, much like Shane and Amy were before, I will still be here at the meetings, but so not gonna go that far away. As far as the regular agency updates, right now, we are still kind of, working to better insulate ourselves, with the recent reductions in different grants that have happened at the federal level. It's something that everybody involved in public health is experiencing. Probably most notably for us is in that March and April, and I think we discussed it at the last meeting, we had that reduction, in those COVID-related grants, which obviously caused a little bit of, just some disruption since it was so quick and so immediate. And so one of the things that under Dr. Weaver that has helped us lead through is trying to be in a better position, which is really identifying what are our key priorities for the state. What is it that we need to be, focusing on to improve the lives of Hoosiers, and then being able to keep those priorities so that in case there's ever a shift in funding, again, that we already know what those priorities are, but we've also identified what it means then to have those reductions.
What departments were mainly, impacted by that reduction in the COVID? I mean, where was the money for the COVID-related grants going to?
They were really kind of widely spread. I mean, like we saw some major hits to especially like laboratories, which was receiving some, as well as some of our epidemiology was in those areas.
Any drug patient?
We really worked hard to make sure that any reduction didn't impact Hoosiers. That everything that, any reductions we would feel, but not necessarily to those services that were being provided.
You're right. Probably the one that was closest is we did reduce our mobile units that we're using to help serve across the state,
Yeah.
but the team has a good plan to backfill that. We kept the teams around long enough for us to do all the work that we'd already committed to, mostly vaccine clinics over the summer for schools. So it's not just vaccines. They're doing hearing and vision screening and other things as well. But we've minimized that from 10 down to 6. So just have to think differently about how we can respond and do that work. Another big hit that wasn't that big decrease though was in the Division of Nutrition and Physical Activity, who lost their SNAP funding.
Right.
So we're looking to help supplement that. I think the biggest problem is, and that's where we're setting these priorities, is that this funding was being utilized for some pretty big data projects that we were halfway through. And we had to scramble really quickly to identify other funds to be able to at least finish out the project to some kind of minimum. That was, yes, we lost some staff and some contractors and all of that, but that was probably the most difficult thing. Like, we couldn't just walk away from these $1 million data projects.
Oh, golly.
Yeah.
You're halfway completed, or you got,
Yeah, it was
you're
frustrating.
sitting on data that,
And talk about, that's why we were, I think I'm so proud of the team, did a really good job. We knew this was one-time funding. And so we're like, how do we use this funding to help, build an infrastructure that we can use for a long time that is sustainable? And so that's how we were utilizing it. But we thought that we had another year to finish out this project. Yeah.
Tough. Hi. Is it appropriate maybe at this point to see how the local health departments are doing, with the loss of funding from the state?
Most of them have recovered mentally. I think it took them a couple months, really,
Yeah.
or a month or so to just kind of, get their bearings and figure out a plan. But they are still positive. They're going to be able to do some good work. They're just not going to be able to do as much as they were planning on, and they didn't have to walk away from the project. So also disappointing. We have met with our cheerleaders and the legislators who want to see more funding go back to this, and they're like, let's give it a rest over the summer, and then we'll come back in full force in the fall, talking to people and promoting that this is the place to invest. The governor believes in prevention and getting ahead of poor health outcomes, and so trying to get the legislators on board, like, this is the program that delivers that is very important prevention measures. Yeah.
I've gotten a little bit of positive that they're going to revisit, rethink, I think.
Yeah, I hear that from
Chipping
everybody.
at it.
Yes, yeah. We just can't, it can't be like, wait until 27 and be like, hey, we're back. Remember, we need more funding. So what does that look like between now and then? Yeah. Without driving people crazy.
Right.
what's the timeline?
That's right.
So Laura, do you add any color commentary to what? When they just-
Really, the thing is, the things you already started, trying to find the sustainability to keep them going, because now people are relying on them, right? It's much easier to shelf things you never started that you had a plan to do.
Give us an example.
Lots of them, but like, we have really pushed on the Child Fatality Review Board at putting a community action team in place. And then they have funds to be able to carry out the tasks that were identified. And it was hard enough to get our prosecutor on board to do that. Then we got him on board, and now it's like, oh, how are we going to keep doing this? But we're going to figure it out because it's important. But it's just, there's things that already started and then you take them away, I think, is much harder than not doing things you have
Had
planned.
you hired anybody that you had to get rid of?
They had hired people,
Who's they?
the health
County
department, yeah, the health department, they had hired people. They combined a couple of jobs. People got nervous when they heard the funding was going, and we had a couple people who just jumped ship, and so, probably unnecessarily, honestly, but they did, and so they combined some positions. What were two full-time made them into one full-time position. We'll see if it works, I mean, but.
We had a couple of counties who were providing prenatal care, and they're gonna have to back off of providing prenatal care, because you have to pay for a clinician to be able to do that. I mean, they're still gonna connect people to services, but to be able to actually initiate it, that will look different. We have, many of our health departments have, we're collecting the data and the information on exactly what they had to stock. People are asking, had hired additional nurses to help to do the work, and are letting, had to let them go. Other positions in the regulatory space as well. So definitely people have lost their job, but mostly they had granted funding or had plans to grant funding to stakeholders in the community to do the work, and that's where they had to stop.
But that's different than the FSSA Medicaid cuts, which you've got nothing to do with.
Oh, no, we're all in. Our hands are in that too.
Well, so the consequences,
Yeah.
consequences of that is likely going to be large, right?
Oh, yeah.
Oh, yeah.
It's all health outcomes.
And because all the providers are going to have to ration care through their slots, there's just going to be less, which should add to the public health burden.
Yeah.
Right.
My biggest worry is prenatal care,
Yeah. it will add.
because that's gonna lead to bad outcomes and not getting prenatal care. So,
A cascade of problems
that follows.
from beyond, beyond that. Well, I just want to say I really honor all of you who are doing this
Kudos.
work. It's got to be agonizing, and you've done a marvelous job. We appreciate it.
Our teams
We do have a great team.
have been just great for it, so.
I mean, everyone was walking around worried about losing their job here too,
Yeah.
right? So
Right.
the fact that they were able to, they had those feelings, but navigate it and move forward, right? And still focus on, okay, but our primary focus is not taking away services to Hoosiers. I can't tell you how many staff wrote themselves out of their job. They're like, if we need to cut funding, it's me, take me. It was, that's just the people, we work with, yeah.
Wow.
Yeah.
Well, and that relates to your comment about people have psychologically adjusted, right? Because you kind of have to do that
Mhm.
and then regroup and see how you're going to move forward.
Oh, to Michelle, is that the end of your?
Yes, I think anything else, I walked in the very beginning of the POH update.
I think of something I will send it, if it is okay with the
Yeah,
president.
and then I will say we continue to work on the executive order, requiring the Make Indiana Healthy Again. And I think that's probably the Healthy Hoosier Foundation, as well as our division of nutrition and physical activity, are gonna be really big into that, and how we look at, how do we make sustainable changes, and educate Hoosiers. So it's a very exciting time.
Just one thing that with the Medicaid cuts, they do have in the big, one big beautiful bill, the rural health transformation funding. And so we are working with FSSA to make a plan for Indiana's application. So 50% of the funding is guaranteed to come to Indiana to help support rural health care. And then the other 50% that we potentially, or the other 50% of that big amount of money, we have to make an application for. So things that they're looking at are innovation. So, telehealth, wearables, acknowledging that things like transportation is an issue in rural communities that are affecting healthcare. So some of the things we're talking about is, to go back to prenatal care, if a hospital were to accept this funding, thinking about maybe something that's similar to Health First Indiana, to have some, okay, well, then you're saying that you will make sure that this geographic area has access to prenatal care. Even if you don't deliver babies, You as the hospital, are you responsible for this? There's lots of components to it, and we're waiting on the details of what that application is. And so right now, we're just getting ideas. We're working with Indiana Rural Hospital Association, clinicians across the state to get information on that. So that's 5-year funding, and it's meant to, again, build infrastructure for sustainability, and we would expect for it to go. But it was in response to people saying these Medicaid cuts are going to affect rural communities the most.
We've been noticing people already getting bumped for appointments, like longer waiting periods if they have Medicaid. And then, I always tell them, put yourself on the waiting list,
Yeah.
if they have a cancellation, but that has increased, means that they can't get transportation last minute. So we ended up buying a second van just for transportation. And luckily I had a family that we'd helped in the past, and their elderly parents passed away, and they sold me this van for dirt cheap. But I felt like it was a necessity because I had so many staff, and our van would be gone, and I had 2 people out in their own personal cars taking people, and I'm just like,
That's what happens. You either can't make an appointment or you get bumped, and then you call you.
so then they get on that cancellation list. Well, they get an appointment in 2 hours, so they call and they can't get public transport, and the Medicaid transport won't do it that short of notice either. And a lot of times for us, those people are coming from Indianapolis or Lafayette, but anyway, to come and get them, to take them like in an Uber or Lyft, well, they don't have enough time to even get there to
That's
get
what I'm
them.
hearing from the hospitals.
Yeah.
And some of the cuts that had already occurred, you tell me if I'm wrong, were retroactive reimbursements that had not yet been made. So the cuts were, from a business point of view, that's already an asset. It's an accounts receivable.
Right.
It's worth $1, and suddenly it's worth 60 cents because you're not gonna get it, but you've spent the money to provide the service. So I talked to some young man in Elkhart County in Goshen the other day who does mental health stuff, and he says, we're not being paid for what we did
Right.
2 quarters ago. And he wasn't really complaining, he was just saying, what are we supposed to do? So we have to use current income to basically pay our past expenses. That's why I asked you to, so I get, so it's just like any of us, the doctor's office or the dentist or whatever calls and says, I had a cancellation. You can come in right now.
Yeah, but they rely on public transport or Medicab, and they can't get it at short notice. So then, like the other day, I had 5 staff members out transporting people to a doctor's appointments. I only have 15.
That's our number one thing to address, is transportation. Yeah, it's a very big top of the list.
Job, Laura, or they have another job and you just say, hey, will you run him up to the clinic? And there you go.
But is it transportation rural or urban? Is it everywhere?
It's rural.
It's
rural.
rural. That's what I
Yeah,
thought.
they don't have Uber, they don't have Lyft, so if they're
Yeah.
trying to, and you can use that for Medicaid
Right.
purposes, but they're all in Indianapolis urban areas.
Right.
If you live in a rural community, they don't have a bus, they don't have
That's what
taxis,
I
they don't have
thought.
Uber.
Yeah.
Yeah.
Our public transport that gets the DOT grant, they want 48 hours notice for a doctor's appointment. Well, if you're on a cancellation list and somebody gets you in, you can't. And here's what happened I think last week was terrible because I think parents scheduled all this stuff last minute, and then they realized their kids went back a week earlier to school, so they had more cancellations than normal. But like I said, I had 5 staff members out at one point transporting people. And then I only have 15 staff members, so a third of my staff is doing transportation.
So, I mean, that's kind of where the telehealth part of it comes to, is that if you can't transport them, is there another way for them to be able to communicate and see the physician? And that's where I would love to see our local health departments. You and I talked about this, right? If you have a mobile unit, you don't see very many people moving around, but all of our health departments have a brick and mortar,
Right.
and all of them have a clinic room space, right? They give vaccines in there, but you can see a patient in that space. So how do we help the community know this could be, the local health department nurse could do the blood pressure and, those types of things, and then you get them on a iPad to talk to a physician. The other thing is supporting a teleconsult, which I don't know if I talked to you guys about before. So like if I am a family medicine doc in Clinton, right, and I have a patient in front of me with this terrible rash, and I've tried what I know to try, and now they're on a 1-year waiting list to see a dermatologist, but they're miserable. Now you could just, what we're working on is to be able to call me as a doc, talk to a dermatologist. Here's what I'm seeing. Here's a picture of it. What should I do? But right now, the dermatologists, even if they do it, they would do it out of the kindness of their heart, and there's not a payment process for that.
Right.
So how do we set up the payment process, and then how do we make sure that we have the technology and the community to be able to do that? It's worked really well on psych. We do that for psychiatric patients right now, for pregnant women and children. So how do we extend it to other specialists?
I was gonna say that Be
Yeah.
Happy and the
Yes,
Chair
that's right. Yep.
are great programs.
Yep.
That they're like the beginning of being able to do this.
And then it's education for the clinician. Right now, when I see this rash, I know what it is. I don't have to call the number. I know how to treat it. So it's like this continuing medical education.
But what I like about the mental health is that the physician, the psychiatrist that talks to the primary care also sends a written summary.
Mm-hmm.
Because the consult, he said, she said, and then there's a concern and nobody perceives it. So I know that they follow up with documentation that I think is really important.
Okay.
Yeah.
I know one of the things we did, we have 2 computer labs, one in each building. And the last time when we changed computers, we made half of them laptops so that they can go into a private office for a consultation. Because Clinton County is 92 out of 92 for devices other than a phone and internet access. So even if they get telehealth appointments, they can't do it at their house, right?
Well, I suppose that is, maybe 92 out of 92.
You know, I think part of it is because, obviously the rural setting and getting farmers to let you come through their land to lay
But
fiber,
there's
all
20
of that.
counties in that strip of the state that would be identical.
Yes, I agree, but we have terrible fiber access in Clinton County. I mean, it's like minuscule. I live literally 100 feet off of a highway, and I have to get Starlink.
Wow.
Yeah, because,
So you don't have 5G,
oh no, well, it's
which is
just,
faster than the cable.
yeah, I mean, if anybody has anything, it is on their phone. And honestly, coverage in rural areas is terrible, you know? I mean, you might have it right here, but don't walk to the other side of your room, you know? And that's literally how it is. I mean, Libby had, one of her pregnant moms that needed an appointment, but she was on bed rest, so Libby did an appointment with her virtually, and she was in her bathroom, and Libby's like, "You're on bed rest, you're supposed to be in bed." She goes, "I don't get internet I don't get any, data in my bed." And Libby's like, "Okay, just hang up. I'm gonna drive to your house and come see you," because she literally had to go to the bathroom to get data to do a telehealth visit. I mean, that's crazy.
Can you, do a telehealth through a phone connection?
Mm-hmm. Yeah.
That's, considered secure enough, and so at least with,
You mean a landline? Is that what you mean?
no,
No,
just phone in general.
But you
I
still
know,
have to have the connection.
of course, yeah.
You know.
And like if they live in town, they probably have connection to do a telehealth. But if they're in a rural area, I mean, there's no way at my house I could do a telehealth appointment on my phone. I mean, I could connect to my Starlink, but I could not do one on my internet or my mobile data. There's no way.
I love,
Cuts in and out
yeah.
too much.
I love the idea of the health department being an area, because I know patients in our area, in rural areas that go to libraries.
Yeah.
And
And
then,
it's not private,
and
really.
it's not private, but at least there's a computer, but the health department, and you've got a clinical person that can do vitals.
Yep.
That would be a great role for a local health
I
department.
went to the Indianapolis Public Library that day. You could register for care after the Affordable Care Act, just to see if that happened. And wow.
Yeah.
And we live a few blocks from a brand new library on Michigan Road. The parking lot is full now because of school kids
Mhm.
with their phones,
Mhm.
downloading because all the assignments now are online,
Uh-huh.
and they don't have high-speed internet at home.
Mhm.
So they go to the library on 421,
Download
or
it
the
and
new
go
one
back
just
home.
east of Glendale, and they sit in the parking lot. So when we say, well, as a backup, there's telehealth, on the other side of that is
Access.
environmental impediments that you just can't.
It'd be a lot easier for her team to transport them to the health department
Yeah.
than to drive them all the way to Indy or
Yeah.
wherever.
The health
Yeah.
department's in our same building, so it'd be real easy for us.
Right.
Yeah, but
Yeah.
that's not the
It
normal case.
decreases the
Yeah.
space transport.
I just had this conversation with one of our US Congress people who was, unaware is too strong a word, but the last mile problem, what we're talking about, just not aware of the degree of difficulty
Yep.
that family has to go to that connect. Sort of like getting cash in a neighborhood without an ATM. You just can't do it. And so that's an aha.
And just providing that space, like she said, the health department is closer than going to a
That would
city,
be great.
you know, 25 miles
Yeah.
away. I mean, we're doing the same with
Yeah.
our mental health. I have a mental health group that comes in every Wednesday, and I give them 2 offices to use every Wednesday because people can't make it to Lafayette. So if I provide that space for them for free, they'll come there, and then the clients can come there. So,
They're
makes a
very
big
lucky to have,
difference.
they're very lucky to have your organization. I mean, because it's not every county that has that.
No, we don't have
So
you
you're
in Evansville.
So they're very lucky.
The thing is, you know, people are like, well, what are you charging me for rent? I'm like, I'm not charging you anything for rent because you're serving our community and this is a need. So if you want to tell me what day you want to come and I will have office. You know, it just is a need and somebody has to step up and say they'll do it, you know, and we have more room than the health department has. So for us, because we have 2 buildings, so it's a little easier for us to.
Are there mental health professionals that come, Laura, from other counties?
It's Valley Oaks, and they're in Lafayette is the primary office.
I see.
And they are now our CMHC, but they don't have brick and mortar in Clinton County. Well, here's the truth. They'll meet people in community-based settings, but once again, do you want to talk about your mental health at McDonald's or the library? And a lot of people don't want people in their house. They just don't. And so, you know, it gives another alternative.
Yes.
Sounds like you're on top of it, right?
Yes.
I mean, just like going on.
Yeah, oh, yeah. Which is why I love my relationship with my local.
Well, that's why we're here, to help us-
Yeah.
to enhance that.
It just, yeah, people just don't realize the obstacles sometimes. If you don't live it, you don't know it, right? So.
Well, thank you. Great update. And we could talk all day long about it, for sure. We can move on to the next.
Go ahead.
Okay. Well, so Abby and I, 4 weeks strong for me. But one of the things that we were talking about is bringing more awareness and education around HHS. And she's going to go ahead and share some information around putting some content together for a landing page on the Public Health Institute network. They have a site that we're a part of, and there would be a landing page that all of our information will be going on to. And we'll get a drafted content to you all too and get feedback at some point for that. Amy,
There we go.
hand it over to you.
So, since the draft concept was.
No, we haven't done it yet,
Oh.
so I'll get that to you.
We're getting things nice and pretty for you. So on the National Network of Public Health Institutes website, this is one of the first things that John sent me, when I came on. And this is the example that was provided, the South Carolina Institute of Medicine and Public Health. It just acts as sort of like a landing page, and what I really like about the intentionality that, NNPHI has put into this website is that you can actually filter by state to find a public health institute in each state. South Carolina is like one of the first ones to have their landing page, sort of figured out. So that's why it is, the example at this moment in time. And so it gives us space to talk about like when we were created, why we were created. It has tagging, which is really important. So if someone comes to an NPHI and is looking for, other institutes or, depending on where they are, they're looking for women's health and they were to search it, the South Carolina one would pop up. Because they have provided tags for like aging, chronic diseases, health policy, health promotion, women's health, worker health. And so we can pretty much put down as many tags as we would like. They did not give me a limit on how many, which I feel like they might regret, but gave us, so that people can search us with just some keywords. It allows us to talk about where we've had impact, what we're hoping to impact on. We get to bring out and highlight like our partners, both public and private. Their list is pretty long. They included, I'm assuming, a good portion of their government, which our list will look pretty similar. That's the Capitol building in Columbia, South Carolina, if you've never been there. Good looking building, kind of looks like ours a little bit. And so, yeah, we kind of we have control over the content that we get to put out. And so because we're ramping up a few different projects, we have quite a bit of paragraphs that we're working on right now. So as we finalize those, we'll have them like ready. We can also share any publications. So, you know, if we get written about or we do the writing or a local health department is highlighted somewhere, like we're able to share that information here as well. So yeah, this is one of our visibility projects that we're working on right now to get more information about us into people's homes.
So, does Indiana have an Institute of Public Health?
That will be us.
So and
Yep,
is anything
we-
special you have to do to be determined or deemed an Institute of Public Health? Yeah,
So
so-
as far as this like website goes,
Not a
this-
website, the
yeah.
actual, I mean, you can't call yourself unless you are one.
Yeah, that was before me. So if our
John
membership, yeah, the membership, yeah.
Yeah.
I was given the link and told, let's like put something
Okay.
together.
So we are the Institute of Public Health.
Yeah, so,
Yeah.
each state is allowed, I mean, there's one lead one. We
Yeah.
are the designated one for Indiana. It was an application process that talked about what we wanted to do.
Yeah,
What we focused on was outreach and preventative care. And, I think that we applied and they accepted us. And then, yeah, it's just a good way to kind of
Yeah.
connect with other people, see what they're doing. It also gives us additional, opportunities for grants that they are doing and some of those grant support.
I believe we were talking about it. There's like a conference every year too, correct? Or something
Yes.
that can be attended that you can
there's
network.
I get emails from institutes or, updates on other institutes of public health. And I thought I got one from Indiana, but if we don't have a website, I'll have to look it up, yeah.
I can.
And in addition to that, we're gonna revitalize the website as well through IDOH, where HHF is at, and work with OPA and things like
But
that.
this was one of Paul Halverson's recommendations,
Yeah,
the National Association of Public Health Institutes.
right,
He said it has valuable information, so John followed through,
yeah.
on that.
Probably one we could definitely utilize more. Additional time now that
Right,
we have two folks in the place. I think
Yeah.
that is a good place
Yeah.
for us to grow.
when we get listed within the Public Health Institute system, are we called Healthy Hoosier Foundation?
Yep. There's and if you can see, there's another one. Like I said, we're kind of like the lead one. There's the Indiana Family Health Council. So when we were applying, we actually had to get a letter of approval from them, kind of saying like, yeah, we understand, like,
Yeah.
they focus a lot on, more like the reproductive area. They were like, you know what, I think just to better serve the state, that's kind of the deference that we got.
Any relationship, maybe when I get it is the School of Public Health. Maybe that's right, yeah. Did you talk to anybody up there? Because I get a lot of updates related to public health, related to the School of Public Health.
I don't think of anything other than,
Institute, I don't know.
yeah, I think it kind of ended with when Paul left.
Okay.
Any questions on that? Well, we'll send you the content to review, see, get that in a better cleaned up draft. All right. Quick update as far as positions. As I mentioned, I finished my 4th week. And Abby, we got everything switched over and under HHF.
My
and-
badge work. I'm rocking and rolling with the new assignment.
So we're excited to get started and, looking forward and work with you all.
Now, I know, Michelle, you are doing 2 jobs. Are you also, Abby?
Not anymore.
No. Okay.
I gave up well, I didn't give it up. I was forced to give it up. But I wrapped up my previous position with IDOH, so I have transitioned into fully HHF.
And still working on Division of Nutrition Physical Activity work, with my previous position as the Food as Medicine Director. And I'll talk a little bit on the Elevance Health Foundation application. That was kind of like both hats, filling that one out. But yeah, and continue to be that thought partner where I can be for IDOH, in my position as well. We already went over the executive order. Dr. We were just talking about getting the 990s onto the website and following the EO for that. And then going into the 2 applications that I have submitted. Number 1 is the Gilead application. This is an organization, kind of a bioscience organization that provides medicine for HIV and STI. And the Division of HIV, STI, and Viral Hepatitis has applied for that, about $309,000. They just updated the application. I've been going back and forth between Gilead and that division and making sure everything's accurate within the portal. But it's been submitted and Gilead's leadership has reviewed it. The next step would be a contract. And then, so their goal is 28 facilities and working with the local health departments on this project, and doing HIV and hepatitis C screening in 28 Indiana jails, and syphilis. And yeah, I've learned a lot about this division and the work that they do in the last few weeks. So it's been great, and I'm actually looking forward to doing that with all the divisions and really how we can support them and really continue to meet the goals of the foundation. So then, yeah, I'll send that your way when the contract is through.
Sure.
Okay, sounds good.
So they already have the grant, it's the contract just going through.
Yeah, so it was something that was previously, there was a year and a half of some delay, and we appointed them in the direction via HHF to utilize the
Delayed by
foundation.
Gilead or by us or
State is very hard and complicated for the state to accept, sometimes grants like this.
I know.
Yeah.
And so that is
why
why
we were formed.
that is,
Yeah.
so,
That's
so
exactly.
it is the repivoting of this to be like,
I think
through
this
this
is
way, and
perfect.
it'll make
Yeah.
Well, Gilead, I know about. It's a pretty clever organization. There is a balm in Gilead that heals the sin sick soul, is where it comes from.
Oh.
So they were, yeah, I mean, literally, that's a hymn and a version and a quote out of the Bible. There's a balm in Gilead that heals the sin sick soul. So they target the sickest. And they've targeted HIV and STD and untreated folks in jails who've not been identified or just causing more problems. So I'm glad we're involved in that.
Yeah.
I wonder why they picked jails. Do you know?
Go ahead.
We do see a higher incidence of STIs in our jail population.
Yeah.
And our team's already started to do work of this testing and it's been successful. And so this is gonna expand the ability to do that.
We had an increase in syphilis in Evansville, and when they started, the health department started tracking it, it was in people that had just left jail or were coming out of jail. So then we focused on, we need to take care of them while they're in jail before they come out. We see that a lot, yeah.
And this is some shared funding, like IDOH, you know, to your point, is covering like the screenings and things like that, whereas this particular grant is doing some
I'm
capacity
speaking as a
building.
lawyer now who's been a bail commissioner. Jail is chaotic. So, I mean, it's not the Reuben Receiving Center here, 3 blocks away, Eskenazi helps staff it, is chaos. And it's hard, very hard. It's co-ed, it's a huge room, with barriers that are only this tall.
Okay.
Rooms to clean the inmates, I shouldn't call them the inmates, the arrestees.
Vendors.
Yeah, and it's
Is
a
the
huge,
vendor wrong too?
yeah, huge
Recruit
turnover in
individuals,
staff.
yeah.
That's why I asked you, jails have the highest incidence, but they're not great at capturing the data and then handing off. And I don't know what to do about that. I just happened to be at the Damien Center yesterday. They've opened a lookalike FQHC.
Oh.
And they have a pharmacy and get 304B money, on East Washington Street. Be worth somebody's visit. I'm happy to introduce you to folks.
Probably 340B money for us, isn't it?
Yeah.
Yeah, we're actually, I'm going there. They invited me, so why don't you go with me?
Good. And it's a great building.
Well, I want kudos to the physicians that were creative enough to request the grant and get this done.
Yeah.
They're very passionate.
Yeah.
They're gonna do a really great job with that. And then the second one is the Elevance Health Foundation. This one was specific to food as medicine. Very quick turnaround, maybe a month to put it together. But, you know, we already have a lot of good framework around food as medicine and foundation created, for Indiana. And it's a pretty long application here. I just wanted to make sure I was transparent in what was submitted and everything. But the goal of this particular application proposal is to support implementation in two of our robust produce prescription programs that we see right now in the state. One is through Parkview Health, and the other one is with the Marion County Public Health Department in their partnership with Eskenazi Health. And so we would support some capacity building within those organizations to keep the program growing and expanding and innovating. And at the same time, we're really taking those programs because we're still figuring out that standardization of a produce prescription program, from duration to dosage of the produce to evaluation and what needs to be collected. So we're taking those organizations and being able to replicate that within two rural hospital systems or settings. We will work with the Division of Chronic Disease, Primary Care, and Rural Health to stay connected on the hospitals that they work with. And in addition to that, creating a comprehensive process for evaluation and collecting of metrics through partnerships with what we have with the Indiana Health Exchange information and registries. I don't know what that looks like. You know, I have this vision of there's so many other ways that we're collecting information like that through other types of programs or immunizations and vaccines. Like, how is this data being collected where everybody that's participating in these produce prescription programs, we're able to collect that same information from everybody and be able to
So
report out.
Lindsay, when we met with the governor's office, they told us she told us the priorities. One of them was chronic disease management. And it included food as medicine as a component. Divisa will have just be in support of that priority.
It could be,
But it's not intentionally now.
yeah, Secretary Thatchev is, that chronic disease management is what she's interested in going.
Well, I asked her to enlarge on that, and she did. Sent me a document, and food is medicine, she specifically mentioned.
Yeah.
So I was curious.
She wants to have a clinical pharmacist help to manage chronic diseases like diabetes, hypertension, smoking, and obesity, and just recognize that food is a component of it. But we actually have really great data that it
Yeah, I was
does
gonna
help
say, that's
improve
not
biometrics.
Newsflash.
No, biometrics, utilizing food as medicine. So this is expanding it, and I'm excited. Thank you for doing the application.
Yeah, absolutely. And there is a big research project happening with partnerships with pharmacists and pharmacies. I think it's the Robert Wood Johnson Foundation is doing something that is going to kind of take that avenue of, I mean, there's so many ways. When you say food is medicine, people are like, well, what do you mean by that? And so really trying to explain and define the actual intervention types is what's important. And for us specifically in VMPA, the nutrition physical activity, it's been produce prescription programs that we wanted to focus on for chronic disease in general. But when you move into like maternal health, where there's maybe more like medically tailored groceries, where you're meeting other nutrient needs.
Is there any self-monitoring built into this? So where they're checking blood pressures at home and weights and reporting them?
I didn't write it that in specifically, but I think that's a great idea.
We found a lot, like if they're keeping an eye on it themselves, it keeps it at the top of their
Yeah,
priority list.
absolutely. Marion County, they put in their budget for some, point of care A1C
Mhm.
machines because they're finding it's kind of been difficult getting chart reviews of A1C levels. So this is kind of a way that they can get more accurate, or at least get more
Yeah.
information around A1Cs.
A really exciting thing that they did in their most recent produce, prescription, like looking at their data, is it's, the majority of them are women. And then just thinking, because so they asked them, like, have you increased your your fruits and vegetables? And so just, I asked them, I'm like, we need to find out, is their family eating more fruits and vegetables, right? So if the woman is the one who's bringing in the food, it typically is the one who is like setting the meals for their family. Is it going beyond just helping the health of the individual that's getting the produce prescription, but actually expanding beyond that? So, but back to her point, I mean, it's always data, right? We think that that's our hypothesis, but how do we actually collect that information? Yeah.
Mhm.
So
And
you
we,
better have these conversations now with
Yeah.
II, if you're expecting.
Yeah, you and I need to talk.
Yeah, and
Well,
Lindsay knows all about it, but they'll produce 100 pages and maybe one paragraph will be relevant and it's needle and haystack work to.
Mhm. Find it.
I just
So
talked to
fine.
Naeem about it. Yeah.
Okay.
Yeah.
And Cleveland Clinic and Kroger, decades had diabetes-friendly aisles and so forth, and the
Yeah.
issue wasn't access, the issue was that people would use it. I mean, the cake bakes in the next aisle, and then
Yeah.
which aisle will you go? Will you go down? New York Times did a front page article a few years ago, why do kids eat fast food? Cheap,
In their face.
and it fills them up. Where does mom drive into? And what pediatrician in Shelbyville told me the enemy of good health is the tippy cup
Yeah.
full of orange juice, which is basically sugar, which they say here
Yeah.
in the back seat, and the kid kind of sucks on it. They take it away, the kid cries, so they give it to him. This
And then their
is hard.
teeth fall
So
out
this
of
is what
their-
Jeff Bennett tried to do 20 years ago. And we found a academic in Florida who, published a paper on it, and we were never able to get outcomes data from her anyway. Like training the kids who are shopping with mom on what does a fruit and vegetable even look like.
We have 4 community gardens and it's, I would say 90% women who come and either pick up vegetables that we've already picked or that I just catch them either on camera or when I'm out there working, they're out there. So I encouraged this lady I was talking to the other day. She's like, oh, I have 3 kids under 10 at home and we just can't afford all this, fresh vegetables. And I said, well, take as many as you need. I said, but I'd love to see more. And she's like, well, and I said, I'd love to see you bring your kids out. And she's like, oh, I just never thought about it. And I said, yeah, they need to know where this stuff comes from, that they can grow this in their backyard, And she's like, well, we live in an apartment. I said, but maybe you won't always live in an apartment and maybe they won't always live in an apartment, right? I said, so, I'd love to see you bring your kids out. And I said, you can drop them off and for a half an hour, they can pick veggies with me. We do it every Monday morning at 7 a.m. before it gets hot. I'm like, you can bring them by. I don't care. And she's like, really? I said, yeah. Because I thought, I bet she gets away so she can have 5 minutes by herself. And I said, yeah, drop them off to me. And I said, and I have, stuff that they can plant and grow in the windowsill and stuff. You don't have to always just have a yard, So she said she's going to bring them next Monday. I hope she does. So.
do we have any data on what keeps families, say the moms who are the ones that, or the grandmothers or the main person, from accessing healthy foods? I know that there's it's not just money, but sometimes time. They preservatives keep foods to get longer, so they don't have time to get them fresh every so often. And then the
The
cooking.
other thing is the cooking.
The cooking, which
Exactly.
when you said fast food,
Yep.
it's not just fast, it's there right away versus going home to cook.
Mom's working 2 jobs and, yeah.
So, because we need to give them, okay, how do you break that barrier? Give them pointers on how
Yeah.
we can overcome it.
We're doing a food as medicine cooking
Yeah.
class right
Yeah,
now.
yeah.
with Purdue Extension, and I was like, oh, it'll be interesting to see how many we had. And we had 24 show up. I was
That's
shocked.
so important, giving them, you know.
Yeah,
Um,
I was shocked.
another program, bought, crock pots
Yeah, that's
and
what we're
gave them
doing.
recipes.
That's what we're doing.
I
We-
love that. I
they're
read
getting
about this.
an
yeah.
air fryer and a crock pot if they
Yeah.
come to so many of
Because
the
they can
sessions.
start it if you have to go to work or whatever, then it's
Well,
ready.
maybe we should teach the kids at the Lebanon Children's Home how to cook.
I would
Yeah,
love to
yeah.
do
Yeah,
that.
Laura is, I've sat in a class with her for 90 minutes. She's a great teacher. She knows how to deal with pandemonium.
Yeah.
You know, a bunch of kids, all of them with various
Yeah.
forms of ADHD, and a bunch of adults with.
I'm going to say that
Yeah, the
adults are
adults
harder
are
to
the biggest
deal with
problem.
than the kids are.
The ones that work there?
The ones that
Yeah.
work there.
Yeah, they're harder to
Yeah.
deal with.
They're harder
than
to
the kids.
deal with, because they speak in their outside voice when they're standing there while you're trying to deal with the student. It was fascinating to watch, because they're all, it's like prison guards, they're totally desensitized to the environment within which they are.
Right.
But I think those kids are young, they're learning how to cook.
Yeah, I agree.
And we've seen some of that. So a lot of like food as medicine interventions get, the nutrition education component can be very different. If the healthcare systems themselves can provide it, they do. If they can't, then it's, yeah, it's that community linkage, whether it's a Cooking Matters program that might be happening, you embed that into the intervention itself. And back to like with SNAP Ed, I mean, that's the biggest thing on nutrition education is like, what are we gonna do?
We lost those Purdue extension
yeah.
people. I mean, that's how they're
We lost
getting paid,
the
was through
Purdue
SNAP Ed.
Yeah.
The nutrition.
Yeah.
component
We
of it,
love
yeah.
the Purdue Extension.
Yeah, they were
The
funded through.
nutrition specialist.
Oh, yeah. I love the stuff they did.
Mhm.
So great work on the Elevance stuff. One thing, and maybe just to keep, or like,
Yeah,
as we keep
yeah.
going, the Elevance Foundation, will be having, like, they have a cycling grant, that are coming through. The next one will be behavioral health.
Yeah.
So stuff around substance use disorder and loneliness, so maybe something to talk to, our division, trauma and injury would probably be a really good one. See if they have any.
Yeah, I think a good subject for our next board meeting with our two brand new staffers is a report on the grants opportunities.
Right.
And aligning the purpose of the grants with the priorities of the state and the department, and trying to draw a line between what we do and what we support. And we've struggled with that, but now we've got the staff to do it. So, Michelle, can you think about the next meeting, 20 minutes, saying, here are the various grant opportunities, here's the need, here's the unmet need, here are the grant opportunities, and here's what we've got pending.
Sure can.
Just a quick question about the biometrics that would show someone is eating fruits and vegetables. You're trying to show changes in their physical health. How often do you track it? I mean, I know you're using chart review. You told me that,
Yeah.
but how often would you do every month, every 6 months? What?
It depends on the duration of the program. Some will do baseline and then 6 months post. Or if it's a 12-month program, they'll do baseline, maybe at 6 months, and then at the end of the program as well. There's some work happening within Marion County's program where that partnership with Regan Street Institute, where they're getting prior to starting the program, and then during the program, and then a year after, to see like even what is those changes after have you been able to sustain like those changes?
So a small percentage of them actually did all the steps. And I just keep on thinking to the WIC program, and we struggle, kids can be on WIC through, I think it's 5 years old, right? And from 2 to 5, they just stop participating because there is this component where they have to come in and get weighed, do all these things, and it becomes not worth it for the families. That becomes a barrier. So we really want the data and information, but that's a barrier because you're asking somebody to go and do something. So kind of thinking through, how do we get to them, right? Is it like mobile integrated health? Is it the person who's delivering the food box, like, hey, let's check your blood pressure really quick? Or is it providing them a blood pressure monitor to go ahead and take that or a scale, and say, hey, just shoot us your weight on an application to kind of help decrease that component of it.
The American Heart Association has some money out there for blood pressure cuff lung program.
Yeah.
It's a lot of, the work that they want you to do on their end, once you have it, but it's a good program, and money for that.
Perfect is the enemy of good for public health, I will tell you that.
Yes. Without those data though, it's gonna be like a lot of programs. You say, well, we, serviced 1,500 people, but if you don't have the data that really show, the change, and I understand the barriers are significant.
But I think you're gonna need it, yeah. I think it's gonna be very
So
important.
people ask a lot of times, well, what's your ultimate goal? Well, the ultimate goal are those pathways for these types of programs to be covered. And be embedded in the healthcare practice.
So what would be nice at our next meeting is to incorporate 3 ideas: evidence-based decision-making. What would you do and why? What would be the data you rely upon? The chronic disease management, bits and pieces that we can fund with grants and gifts, like food is medicine. And then the access issue. Do we have any role in access? And I've learned something today. Without it, if you don't live in a community with Uber or Lyft, so what? You gotta deploy your staff. So evidence-based, and you don't cook up some national voucher thing for Uber and Lyft that somebody in Clinton County finds.
And we do track it. I mean, so all my staff have a QR code in their vehicles, plus we have them in the 2 organization vehicles. So we're tracking how often we're taking people, how far, and to what kind of appointment.
Abby and I are working on a kind of a grants matrix
Well,
spreadsheet
if
right
you
now.
just incorporate those 3 ideas somehow.
Yeah.
Then Lindsay and others can say to the governor's office, we're aligning with these priorities. Is that okay? And the answer will be yes. And then the question will be, well, what data are you collecting and how are you analyzing? This is a familiar conversation. I mean, the food stuff is a very familiar conversation.
I like your ideas of aligning with priorities instead of kind of trying out what's out there. Just what are the priorities of the health department? What are the priorities of the governor? And how can we then align and identify grants that will support our health department and our team?
All right, I'll move on to the last thing. This was really just a question as I'm continuing to learn. I was shared this Walmart Spark Good. It's 501c3s can sign up for them, and it provides, there's like listed grants that are on there that are available that you can look at. And then there's also ways on like fundraising that you can kind of embed.
When you buy
Wait,
something with Walmart, some of it goes to here, right?
I think that's what, yeah, much like how Amazon has things
Amazon
set
does,
up. And my question was just, is this something that HHF is able to sign up for? Is it? What do you?
Until I see it, if
Okay.
we have some info on it.
Yeah, I can send you the link to the page where it shows information about it. It doesn't give a whole lot until probably you sign up, then you can get a little bit better idea of what is available in there.
But what are we signing up for?
It's just a platform to get more opportunities for grants, like some private foundation grants, probably linked to Walmart. And there's like the Walton Family Foundation, like Builders Initiative is part of that. And then it just gives you, if you're gonna go fundraise for something, you can set it up to where, if something's being purchased from Walmart, then a certain percentage goes to HHF. So it's setting up an account.
That seems to be, you guys should have used that. The grants seem to be, 100,000 applicants for a grant that's gonna be awarded to 2 people. And at a state level, you'd have a better chance of getting that. But the Spark program where they donate a certain percentage seems to be the best advantage.
So
to
as
it.
part of this report at our next meeting, you might, part of a deep dive into the grant
Okay.
side, and
Yep.
you might handicap it. 5% chance, 50% chance, 90%, just like an academic thing. So that when we value the probabilities of it, we can say this is a long shot, this is pretty good, this is 100%, and then we know in the ensuing 12 to 18 months what will come in the door. One thing we know for sure, we don't apply for grants, nothing will come in the door.
Right.
So.
The thing that
Yeah.
has been
Zero.
most helpful to us it linked us to Walmart Good 360,
Uh-huh.
which is a program in which they get donations from L'Oreal or Stanley or whatever, and then they sell those at a much reduced cost. And so, like one time I bought 100 scales through there.
That from
And I-
sales.
And I think I paid like $28 for 100.
Oh, wow, okay.
You know what I mean? So that really for us was the biggest advantage, was the Good 360. But it's sporadic, like, you know.
Can't count on what's gonna
Right,
be
you have,
available.
I mean, it may be shampoo and conditioner on there, one, you know.
We have a
and-
lot of our local health departments buying those on their own right now,
Yeah.
using each at $5. So even
Okay.
if this isn't right for us, if you're like, you know what, I can see a health department doing the Spark or getting connected with this and really helping supplement what they do. I mean, I would love
So
for
we
you to
buy
do
for our
that too. Like, here, health departments, like, here's a pathway to be able to get this more funding.
And
Yeah.
to Lindsay's point, that would be on our website.
That's right, yeah.
Yeah,
So this is how you get money.
Yeah.
so we facilitate the health, I love that idea, yeah, because we can then facilitate them, and I think you're gonna get locally more access.
Yeah, so I believe they'll, unless it's changed, they'll only do one Good 360 recipient per county.
Okay.
Unless that's changed. That's what it used to be because I signed up at the very, very beginning. But like, we share ours with all the nonprofits. Like, if I get on there and there's school supplies, you know, last week at a back to school, we did 600 backpacks. So I look at school supplies every time I log on once a week. I see what school supplies are on there. I'm calling Center Township or United Way and saying, okay, rulers are down to da-da-da-da-da. And they'll be like, pull the plug, you know, voice. Or the health department, I've done stuff for them before. So I just, you know, it's very hit and miss, but there are some amazing deals on there.
Am I good to go ahead and just at least set up an account? And,
Oh, yeah.
Yeah, I'll figure it out, yeah.
okay.
Maybe we should have you on the health department, one of our local health department calls, just to explain how you utilize it.
Okay.
And then they can explore if anybody else in their county's doing it, and if they're not, then you can help kind of make a template for them.
You can do it as big or little as you want. There are ones that you can, like, the biggest one we ever did, my husband, we own a farm, so he had semis, and it was the off season. I'm like, hey, I can get a bunch of mattresses for like $500, but I have to have a semi driver in a semi. It's like, what you get me into? Well, that's, you know, and he went to Mattress Firm and picked up, I cannot remember, it was so many foundations and mattresses, and it ended up being like, we paid like $36 for a set. And we had twins and fulls and kings and, yeah, and our.
Life-changing for a family.
Yeah,
right?
so we partnered with, we have a non-for-profit who builds beds. And so we partnered with them and gave them all the twin, foundations and mattresses. And then one of our Wesley Manor, one of our local senior, communities, we actually have 2 huge storage rooms that they let us use to store furniture in. So that way when people come out of recovery homes and things, they have nothing, right? So we take them up there and go shopping and get the furniture.
Wesley Manor's 300,000 square feet.
Yeah, it's huge.
It's bigger than anything in Marion County. It's just shocking.
I have a question, is it one state sign up, or if we sign up, will we not allow then the local health departments to get
No,
it?
that's only the Good 360 part. And it
that's-
used to just be, but the Spark, anybody can sign up
But the
for.
Good 360, if we sign up with this, is this part of the Good 360, is this guide?
So that's how I learned about Good 360 is through Spark. And
Okay,
so,
Spark is the
that's-
Walmart
Mhm.
thing, okay.
Yeah.
I would just create an account and then, yeah.
And then you let them know about the Good 360, so we're not blocking the others from getting
Right.
what you're
And it
getting.
may not be that way, because like I said, I onboarded when it was very first offered.
Mhm.
And so at that time, they were offering one to each county.
So Michelle, you'll do the
Think about
due
it. Yep.
diligence. thing this week.
And give us an update of what it is.
Okay, yep, so we will do that. All right, yeah, I just wrote on there any suggestions on, future presentations, but I think we got a lot to work with the next one. So we'll take it from there. And I just wanted to kind of revisit the bylaws a little bit, and if we wanted to have, 15 minutes left here, but any discussion around, goals and objectives. But
the current one I could find was 2021. John, do you feel like that's probably accurate on the approved one from February 2021?
Yeah, that would seem.
Okay. I have a highlighted version. So it still has like Scott's name on there. Is that something we want to,
With a registration of you, so.
okay,
Yeah, or it ought to be a title here.
okay,
And the address.
yeah,
So I put
Okay.
Executive Director of Healthy Hoosiers Foundation with nobody's name.
okay,
Because that's for service and process. So if somebody looks us up, that's where they send the summons if we get sued.
And then, John, when we sat down, you helped us through some strategies and goals. Can we kind of revisit those and do, where are we and, short-term, long-term, et cetera?
Yeah, I think that's a great idea.
So what I discovered reading the bylaws.
Yeah.
So we ought to have an annual meeting. And our next meeting or the meeting after that, and get back on schedule.
Right.
All of us are appointed by the governor, but the governor's office only responds when we ask them to replace somebody or find somebody, and so
So
it's
just-
on us to figure
It's
out.
on us to figure out, that's what I was gonna ask, what are our terms of appointment and do we get 3 years? And
But because we serve until we're replaced, we've just been blowing through the 3 year.
that's what I thought, I was wondering
Yeah,
when yeah.
We have been updating everybody,
Yeah, we did.
keeping everybody,
Okay.
so everybody here has a term, we have the list.
yeah, it's on the list of, and I can send an updated one.
Let's have 15 minutes of our next meeting be our annual meeting.
Yeah, let's do that and then
And just
just review that.
Refresh our memories and
Okay.
tell us what our terms are, and
Yes.
if we have to reelect the officers and things like that. What we do, it's only a year term, and as far as I know, I've never been elected or reelected, so.
And ethics to that, because we.
Great to nominate you.
Yeah.
Yeah. Don't miss a meeting. We'll nominate you for everything.
So back to my point, we're a type 1. So we just need to bear that in mind. We don't have as much discretion as a normal organization, and so Lindsay just needs to keep us in touch with whoever cares. My experience in the past, the numerous administrations, it's just on the list, and the general counsels, and the past governors only respond if I called them and said, we want to appoint so-and-so, and then it would happen. Otherwise, it's not on their tickler files.
Yeah.
And all, which I think is one item that caused frustration when they discovered all these C3s.
Yeah.
Some of them were ancient.
Yeah.
Ancient, and they were corporations before there were C3s, before the 1954 Internal Revenue, they're like blind school.
Oh.
They're not insidious at all. They're citizen support of state.
So maybe at the annual meeting, we can approve or update the bylaws with a more up-to-date.
Well, just arrange that we can vote for like changing that part, the
Yeah.
language. I don't see any other language that needs to be
Yeah,
changed.
yeah.
It's straight off the lawyer's word processor. There's nothing unusual
Yeah.
about these bylaws.
For the next meeting, bring that change then for saying executive director.
Yes, our February meeting, so you got plenty of time. Well, I mean, our November meeting.
November,
You got plenty of time. October, November, 3 months, do it. But I think what we're really interested in is your handicapping of the grant marketplace.
And we can bring some ideas and stuff too that we kind of come together on just getting the funding and.
And another thought is, I know the health department's got creative and collaborating with other organizations in their community. Is there any other state organization that we could collaborate and look at grants and collaboration?
You should probably talk to the Scientific Alliance, get connected with them.
Yeah.
They're the ones who are connected to, with the, at least the big foundations across the state.
The Indiana Philanthropy Alliance, IPA. They have a membership fee, so we'll just have to talk to them about that. It'd be nice.
Might
if
waive
they
it.
could okay. See if that, okay.
Or at least be a partner, even if they're not a member.
Yeah.
Yeah, they'll have events where they'll, like, it's like an opportunity even just like to pitch, here's what we're wanting to fund, to see if there's any of those organizations that are willing.
Okay,
Yeah.
okay.
They like to put their names on things.
Okay.
So, and you get other business. new business.
The goals, did we discuss those, or we just kind of?
We'll revisit that in the next meeting.
Okay.
Works for everybody.
I think we gave them one goal, that is to come back at us.
Yeah, with the grants,
Yeah, the grant stuff, and
Evidence.
aligning those grants
decision making.
with the goals of the department and the state,
Yes,
rather than create our own.
that's right. So
Yeah.
I think we need to align it with the goals of the department, goals of the state, and then our goals. I think we need to see all that together.
We're adjourned. Thanks, everybody.
Thanks. Tammy, you wanna end the meeting?
We adjourned. Any public comment?
Oh, you did?
Oh, any
Yeah.
public
Any
comment
public comment?
with that?
Any
Oh, yeah.
public comment?
Oh, yeah. Anybody want to make a comment who's online? Ask a question. Thanks.
Okay.
You're done?
Yep, we are done.